Situational leadership in healthcare, interdisciplinary teams, and improved patient care outcomes, presented by Ceresini. Presentation outline, introduction, literature review and related studies, suggestions, methodology, conclusions, and recommendations. What is the situational approach to leadership? The situational leadership approach is a widely recognized approach to leadership, and it centers on leadership in situations. It was developed by HRT and Blanchard, founded on the principles of Redden's 3D management style model. The supposition of this theory is that every situation is unique and requires a different style of leadership. The situational approach is founded on the idea that there are two components to leadership: directive and supportive. Based on the circumstances, the leader must determine which component to use. Directive behaviors focus on providing clear directions, giving definitive goals and parameters, and setting deadlines. In these situations, the leader is directing the followers and the communication is unilateral. Supportive behaviors encourage reciprocal communication between the followers and the leader and facilitate social and emotional support. As this type of leadership is based on a given situation, the leader must be flexible and able to adapt to the changing abilities and drives of the followers, which are presumed to be continuously in flux. Therefore, the leader modifies how directive or supportive he or she is based on the shifting needs of the followers. The situational leadership 2 model is the visualization used to illustrate the leadership style and development level of followers. The leadership styles are delegating, supporting, coaching, and directing. This chart demonstrates the leadership style needed to correspond with the level of the directive and supportive behaviors, as well as the development level of the followers. The development level is the extent to which followers have the competence and commitment needed to achieve a goal. So how does it work? The situational approach centers on the notion that the followers move forward and backward on the development continuum, dependent upon their comparative competence and commitment. It's up to the leader to determine in what range the follower falls to maximize the leader's effectiveness. The applicability of the situational leadership approach to healthcare. In healthcare, interdisciplinary teams comprised of clinicians and non-medical personnel must work together to fulfill patient-focused goals. The situational approach provides leaders with the flexibility and adaptability required to work with followers at different development levels who are striving to reach the same objective. In an interdisciplinary team, the followers inherently have different proficiencies and expertise. For leaders to be successful in this environment, they must be able to adjust their leadership style to align with the followers' development levels, and they can achieve this by employing a situational leadership approach. There have been many studies conducted on the topic of the situational leadership approach. The selected studies provide recent and relevant information to support the hypothesis that situational leadership leads to higher performing interdisciplinary teams in healthcare, ultimately resulting in improved patient care outcomes. How delivery suite coordinators create situational awareness in the multidisciplinary team. In this study, the objectives were to analyze job descriptions to gain an understanding of the organization's expectations of the delivery suite coordinator role. The methodology, qualitative documentary followed by logic modeling. Results, delivery suite coordinators play a critical role in creating a safe clinical environment for patients. This is achieved through strong leadership skills using a situational approach to manage the multidisciplinary team. Limitations of the study. The sample size is limited to 15 delivery suite coordinator job descriptions and cannot be generalized to every role. This is the first study to gain insight into the role of the delivery suite coordinator, and there's a need for further research. Nursing leadership and management, the advanced practice role. The objectives of this study is to determine the root cause of issues plaguing the medical surgical nursing division, including complaints regarding quality of patient care, low staff morale, high call-out rates, and difficulties recruiting new staff. Methodology. Evidence was collected over a period of 3 weeks by direct observation of day-to-day operations of 3 units, which included medical telemetry, telemetry surgical, and step-down medical surgical ICU. The results. Inconsistent or lack of leadership was identified on all units. Meetings were held to educate all staff about the definition of leadership, theories of leadership, including the situational approach, and how leadership affects patient outcomes. Limitations. The study was limited to 1 division within a hospital. Further studies are needed to explore the results of the education provided to the team and how it affected patient outcomes. Partnering for performance in situational leadership, a person-centered leadership approach. The objectives of this study was to determine how the situational leader's person-centered approach of partnering with the follower to improve their performance affects managing the care environment and achieving the vision. Methodology, using the model of situational leadership in residential care, referencing Lynch et al. 2011 study, to determine how to be operationalized in practice through the partnering for performance process. The results. The situational leader diagnoses the performance, competence, and commitment of the follower, is flexible in leadership style, and partners with the follower to optimize performance, and taking them through the developmental levels to manage the care environment and deliver person-centered care to the patients. Limitations. The study is limited to the effects that the partnering for performance has on long-term facilities for older people. The framework used in the study needs to be applied to other practice settings such as palliative care to determine its validity across healthcare specialties. Combination model for sustainable change by utilizing Cotter's change model and the Hersey and Blanchard's leadership model for improving medication errors reporting. In this study, the objectives were to assess whether implementing a combination of Cotter's change model and the situational leadership model will improve the self-reporting of medication errors. Healthcare is delivered by a diverse team of professionals who must work together to deliver safe care, and implementing an innovative idea to improve ME reporting has a goal to reduce patient harm. Methodology. There were 21 physicians, 19 nurses, and 5 physician's assistants who were involved in the study. These individuals were equipped with training and education regarding the importance of reporting medication errors. Medication errors were monitored for 3 months. The results. At the end of the study, all individuals in the study showed 100% willingness and ability to report medication errors. Limitations. This study took a novel approach by blending the situational approach with Cotter's change model, and there are no other studies cited in literature using this methodology. Further research is needed to assess its validity. Only 45 medical professionals participated in this study over a period of 3 months. There's an opportunity to run the study on a larger scale and for a longer duration. The effect of situational leadership and motivation on employee performance. The objectives of this study were to identify the influence of situational leadership and motivation on employee performance to achieve organizational goals. The methodology. Questionnaires completed by 140 employees meeting the respondent criteria. 2 groups of variables were examined. The independent variable was situational leadership and employee work motivation, and the dependent variable was employee performance. The results. The analysis showed that situational leadership and work motivation produce positive and significant impact to employee performance. Limitations. The sample size is limited to employees from one company. From the 1,153 employees who met the criteria to be a respondent, only 140 participants took part in the study. Evidence of a shared purpose, critical reflection, innovation, and leadership in interprofessional healthcare teams, a realist synthesis. The objectives of this study was to determine through what mechanisms working in teams affects outcomes and experiences for patients, caregivers, and staff. Methodology. 109 articles were identified and examined during a two-stage literature search to identify the mechanisms underlying interprofessional teamwork and to find evidence to support or refute the mechanisms. The results. 13 mechanisms were identified while evaluating interprofessional teamworking as a complex intervention used to organize the delivery of healthcare services. Clear leadership provided a shared vision and increased effectiveness of the team members. Limitations. The evidence base for the 4 mechanisms of interprofessional teamwork was small and unsubstantiated, which limited the researchers' ability to understand the relevance to all interprofessional healthcare teams. The assumptions asserted about teamwork in the healthcare field are not founded on strong empirical evidence, and there is a need for more research. Sustainable interprofessional teamwork needs a team-friendly healthcare system. Experiences from a collaborative Dutch program. The objectives from this study was the development of sustainable interprofessional teams requires a team-friendly healthcare system. To make steps forward in realizing sustainable interprofessional care, fundamental changes are needed in the internal organization of healthcare insurance companies and municipalities. The objective of the study is to examine experience-based issues regarding internal organization, perspective, and the definition of effective teamwork. Methodology. The examination is based on a business case analysis of the network, 3 conversations with a dominant health insurance company in the region, several interactions between network representatives and civil servants from the municipality, and an evaluation report of the network development project. Results. The dominant focus of the healthcare insurer was on cost minimization. The healthcare team was asked for indicators that provide insight to the cost effectiveness of the interprofessional team. It was concluded that team cost effectiveness cannot be measured by simple indicators. Limitations. Team effectiveness outcomes are not easily measured and can be subjective. There's an abundance of research on the connection between effective teams and the external environment, but there is not a lot of research on the development of the team. Situational leadership theory, a test from the leader-follower congruence approach. The objectives of this study was the purpose of the study is to use the degrees of agreement between leader rating and follower self-rating to determine follower competence and commitment, and consequently an optimal leadership style. Methodology. Survey data was collected in the form of questionnaires from 168 supervisors and 830 employees from Norwegian for-profit organizations. The data were analyzed to test the predictions put forth in the situational learning theory. The results. The results show that situational learning theory principles are supported when the leader rating and follower self-rating correspond. The data does support the argument that leader assessment would be a better basis for providing followers with appropriate direction and support. Limitations. The study is limited to followers and leaders from similar settings in one country. The development aspect of leader-follower was untested in this study. Managers' leadership style and the commitment of their team members, associating concepts in search of possible relations. The aim of this research was to investigate how managers' leadership styles interfere with the commitment of their team members. The methodology. 5 hypotheses were tested in order to identify relationships between the leadership style and the components of the commitment. The method chosen was quantitative, and a survey was conducted. The data was collected through the application of 2 questionnaires, of which 587 questionnaires were deemed valid. The results. The correlation between the manager's leadership styles with relationship orientation and commitment was significant and positive. The limitations. The size of the sample surveyed, though sufficient from a statistical point of view, could be expanded upon. Data was collected in an exclusively quantitative manner, which could have limited the possibility of finding answers not available in the choices provided on the questionnaires. Situational leadership and its effectiveness in rising employee productivity, a study on North Lebanon organization. The objectives were to determine the impact of the situational leadership style on employees' motivation and how situational leadership affects the productivity of employees within organizations. The methodology. 150 participants employed at hospitals in North Lebanon completed a questionnaire that addressed different aspects of situational leadership, demographics, situational leadership behavior of the managers, and the participants' behavior. The results. A positive relationship was found between situational leadership and employee productivity. Limitations. This study only included 150 participants, and it could be expanded upon. The scope of the research was limited to hospitals in North Lebanon. Suggestions. The situational leadership approach to managing interdisciplinary teams requires the leader to have the ability to address each follower's development level and tailor the method by which the leader utilizes when working with each team member. Teamwork in healthcare requires collaboration and innovation across different fields and requires a leader to lead the group towards the common goal of improving patient care outcomes. This research serves to heighten the understanding of how the situational approach to team leadership gives rise to better results for the team and ultimately the patients. Methodology. The research used in this presentation is based on peer-reviewed studies. Examination of research conducted by scholars on the topics of situational leadership, teamwork, and the relationship to healthcare provided the data analyzed in the presentation. The goal of the study is to research the effects of the situational leadership approach on interdisciplinary teams in healthcare, resulting in higher performing teams and ultimately improving patient care outcomes. Conclusions. This research outlines the utilization of the situational leadership approach in interdisciplinary teams in healthcare and how it is effective in improving patient care outcomes through optimizing team effectiveness. Each follower on different stages of the development scale necessitates a situational leader to correspond to their level so they can provide more effective patient care. The leader's situational-based method of leadership style affects the performance and synthesis of the followers, enabling the team members to work together more effectively and therefore enhance the quality of care patients receive, resulting in enhanced results. Recommendations. Research on situational leadership and its effects on team performance can be addressed in a context outside of healthcare. For example, an analysis of high-performing interdisciplinary teams in education and the resulting outcomes on students' learning would be beneficial for educational institutions. Additionally, this research can be conducted on a larger scale to incorporate a variety of dependent variables across various demographics, such as age and gender.